Let me show you what an anesthesiologist sees when he's about to do your epidural. If you don't want to see a big epidural needle, then look away now. So this right here is the kit that we use. On the left, we basically have a few ampules with medications. This right here is normal saline, which is essentially just water. This right here is 1% lidocaine, which we use to numb the skin on the patient's back so they don't feel the actual epidural needle. And this right here is a special form of lidocaine that has epinephrine in it. Epinephrine is important because it tells us if the medication is accidentally going into the blood vessels instead of around the spine. The epinephrine will raise your heart rate instantly and tell us that we're not in the right place. This is the syringe that I use to draw up the lidocaine to numb up the patient's back. This white tube has a filter in it that prevents any of the glass particles from the ampules from getting into the medication. And now, the moment you've been waiting for, this is the epidural needle. This is the needle that goes into the patient's back. It is pretty big and scary, but believe it or not, even this needle is sometimes not long enough to reach the patient's spine. Thankfully, at the end, the needle comes out and this thin catheter gets threaded through it. This catheter is what actually stays in. It's a hollow plastic tube that gets connected to a pump that eventually gives you medication until you deliver the baby. On the anatomical model, if you can imagine, these are the patient's hips and this is the patient's spine. What we'd be trying to do is essentially get in between these vertebrae and get the needle in there like so, park it here, and then thread the catheter through the needle. And then that needle comes out and that long thin catheter stays in. Once that catheter is in, it's able to give medication and numb up those nerves, which are here on the right and the left, that are sending signals of pain from your labor to your brain. That is the essence of how we do a labor epidural, and I promise it looks a lot scarier than it actually is.